My dear students, a very warm welcome to you all. In this session, we will talk about the metatarsal bones. The metatarsal bones are situated between the tarsal bones proximally and the phalangeal bones distally. There are 5 metatarsal bones and they are numbered from medial to lateral side as first, second, third, fourth and fifth. These 5 metatarsal bones together constitute metatarsus. So the term metatarsus is a collective term referring to all the metatarsal bones together. The metatarsals in foot are homologous to the metacarpals in hand, but the numbering of metacarpals are done from lateral to medial side. That means lateral one is the first metacarpal, followed by second, third, fourth, and the middlemost is the fifth metacarpal. Unlike that, the metatarsals are numbered from medial to lateral. So the numbering convention differs between the metatarsals and metacarpals. Metatarsals numbered from medial to lateral, metacarpals from lateral to medial. In this context, I should mention that the tarsal bones on the proximal end of feet are 7 in number, consisting of talus, calcaneus, cuboid, navicular and the 3 cuneiforms, namely medial cuneiform, intermediate cuneiform and lateral cuneiform. Altogether 7 tarsal bones. On the other hand, the phalangeal bones at the distal end of feet are 14 in number, consisting of 2 for the great toe, namely proximal phalanx and distal phalanx, and 3 each for the other 4 toes, namely proximal phalanx, middle phalanx, distal phalanx, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal. So altogether the tally of phalangeal bones in the feet goes up to 14. So in between the 7 tarsal bones proximally and 14 phalangeal bones distally, there lie the 5 metatarsal bones which are numbered from medial to lateral, 1 to 5. Next are the parts of the metatarsal bones. Each of the metatarsal bone consists of 3 parts. Number 1 is the proximal end, which is also known as the base. Number 2, distal end, which is also known as the head. And in between the base and the head lie the intervening shaft or the body. Okay. The head of the metatarsals articulate with the base of the corresponding proximal phalanx to form metatarsophalangeal joint. Each of the metatarsophalangeal joints are synovial joints of ellipsoid variety. Now, regarding the transmission of body weight, we all know that the body weight is transferred from the knee joint to the ankle joint by tibia. As the fibula does not take part in formation of the knee joint, hence fibula does not transfer any weight. Now at the ankle, the weight borne by tibia is transferred to the talus or the ankle bone. Now the skeleton of foot presents 2 longitudinal arches. One is the medial longitudinal arch seen from the medial view of the skeleton. Another is the lateral longitudinal arch that is seen from the lateral view of the skeleton. That's why the weight bearing points of feet are located on two ends of the feet, and if you take a look at the footprint, then it is easily understandable that the weight bearing points of feet are as follows. Posteriorly, the weight bearing point of the feet is formed by the medial process of calcaneus, whereas anteriorly there are 6 equal points of contact which are formed by the heads of the metatarsals. Now the question is that there are 5 metatarsals, so there are 5 heads. So by that logic there should be 5 equal points of contact. So why 6? The answer is that for each of the 4 lateral metatarsals, namely 2, 3, 4 and 5, there are 4 points of contact. But for the first metatarsal, there are 2 sesamoid bones that lie below the head of first metatarsal, and those 2 sesamoid bones form 2 points of contacts for the head of the first metatarsal. Okay. Now let's consider a case for a person whose body weight is approximately 48 kg. Now let's say this person is standing in a fundamental position, and in that person the weight is distributed as follows. Half of the weight, that means half of 48 kg, that means 24 kg goes to each lower limb. In each limb, 12 kg goes to the medial process of calcaneus and 12 to the metatarsals. So of the 24 kg that is transferred to each lower limb, that is distributed into medial process of calcaneus 12 kg and point of contact of the metatarsals 12 kg. Now we know from the previous discussion that the metatarsals presents 6 points of equal contact with the ground. That means heads of lateral 4 metatarsals 2, 3, 4, 5 form 4 points, and 2 sesamoid bones below the head of first metatarsal, they present 2 points, 4 plus 2, 6 points. That means if the 12 kg is distributed among the 6 points, then each of the point of contact will be supporting 2 kg. It means the great toe supports the double load of body weight as compared to the other toes of the body. Okay. Next, regarding the shaft of the metatarsals are dorsally convex. The shaft presents a dorsal convexity. That means, in other words, the shafts are concave from the plantar aspect. Okay. So metatarsal shaft presents a concavity from before backward in the plantar aspect. The sides of the shaft provide attachment to the interossei muscle, whereas the plantar aspect of the fifth metatarsal gives origin to the flexor digiti minimi. So that is all about the shaft of the metatarsals. Next we move on to the base of the metatarsals. Base means the proximal end of the metatarsals. The shape of the articular surface on the base of the metatarsals differ. The articular surface on the proximal surface of the base presents different kind of shape. For the first metatarsal, the shape of the articular surface at the proximal surface of base, it is kidney shaped. For the second one, it is triangular. For the third metatarsal, the shape of the articular surface at the base is triangular. For the fourth, it is quadrangular. For the fifth, it is again triangular. Now, the base of the first metatarsal, which presents a kidney-shaped articular surface that articulate with the distal surface of medial cuneiform. Similarly, the base of the second metatarsal, which presents a triangular outline, it articulates with the distal surface of intermediate cuneiform. And the base of the third metatarsal, which again presents a triangular outline, it articulates with the distal surface of lateral cuneiform. Regarding the base of the fourth and fifth metatarsals, the base of the fourth and fifth metatarsals articulate with the anterior surface of the cuboid bone. In short, the bases of the metatarsals articulate with different tarsal bones to form corresponding tarso-metatarsal joints. Coming on to the base of the fifth metatarsal, the base of the fifth metatarsal provide the following attachment. One thing I must mention that the lateral side of the base of fifth metatarsal, it projects proximally and laterally to form a large tuberosity, which is called the styloid process of fifth metatarsal. This styloid process of fifth metatarsal gives attachment to the peroneus brevis. Peroneus tarsius is inserted on the dorsal aspect of the base, and flexor digiti minimi brevis originates from the plantar aspect of the base. Regarding the individual salient feature of the metatarsals, the first metatarsal is the shortest, thickest and strongest, and it is adapted mainly for the weight transmission. The second metatarsal, it is the longest metatarsal. Regarding third, there is nothing salient to say. Regarding fourth and fifth, the fifth metatarsal presents the styloid process that has already been mentioned. Coming to the ossification of the metatarsals. Each metatarsal ossifies from two centers, one primary and one secondary. The primary center for the shaft of all the metatarsals appear during 9th week of intrauterine life, except for the shaft of first metatarsal, which appear a little bit later during 10th week of intrauterine life. That means the shafts of all the metatarsal originate from one primary center that appear in the time frame of 9th to 10th week of intrauterine life, whereas the secondary center appears during the 3rd to 4th year after birth in the heads of all the metatarsal except in the first metatarsal, where it appears in the base. That means the second, third, fourth and fifth metatarsal possess a secondary center each for the head, whereas the first metatarsal possesses the secondary center at the base. So that differentiates the first metatarsal from the rest. Now in this context, I must tell you that metatarsals are considered as miniature long bones. Why? Consider the case of a long bone. A long bone is defined as one where the length much exceeds the breadth. Now look at the shape of the metatarsals. The shape of the metatarsal conforms to the shape of a long bone. It has got a tubular structure where length is the most obvious dimension and is way more than the width. But there is a difference. That's why it is called miniature long bone. there is a reason for which it is not called a typical long bone. When you consider a typical long bone, for example, in the lower limb femur, tibia or fibula, or in the upper limb humerus, radius or ulna, which exemplifies a typical long bone, in them there is a single primary center for the shaft and at least one secondary center each for each of the end. That means all of the typical long bones have one primary center and more than one secondary centers. Whereas in metatarsals, there is a primary center from the shaft and only a single secondary center for the head in case of second to fifth metatarsals, and a single secondary center for the base of first metatarsal. In short, a typical long bone possesses a single primary center and more than one secondary centers, whereas in case of metatarsal there is only one primary center and one secondary center. So these are long bones but not typical long bones due to their small size and due to their embryological difference with regards to the number of primary and secondary centers. They are called the miniature long bones. Regarding the clinical aspect of the metatarsals, there is a term that you should keep in mind that is called march fracture. The march fracture typically occurs in the shaft or neck of second and third metatarsals. It occurs due to aggressive prolonged march past by the shoulders when they forcefully thrust their foot repeatedly on the ground for a prolonged period, and that impact is mostly felt on the shaft or the neck of the second and third metatarsal, resulting in their fracture. As per the etiology of the fracture, it is known as march fracture. There is another term you have to remember that is called the Jones fracture. What is that? A Jones fracture is defined as a fracture of the styloid process of the fifth metatarsal, and this usually occurs when there is an attempt of forced inversion of the forefoot. If there is forced inversion of the forefoot, then there will be a tremendous tension on the tendon of peroneus brevis, which is inserted on the styloid process of the base, resulting in the avulsion of the styloid process due to the tension of the taut tendon of the peroneus brevis. This fracture is known as Jones fracture after the name of an orthopedic surgeon, Sir Robert Jones, who himself sustained the same injury. The last topic of the heading is the difference between the metatarsals and metacarpals. When you compare the metatarsals and metacarpals, the first point should be the numbering convention that I have already mentioned. The metatarsals are numbered 1 to 5 from the medial to lateral side, whereas the metacarpals are numbered 1 to 5 from lateral to medial side. Number 2, the structure of the metatarsals are more massive, more strong, owing to the role in the weight transmission. As they have to transfer all the weight of the body, so the nature has made them massive and strong, whereas metacarpals are conspicuously less massive and less strong compared to the metatarsals. Another difference between the metatarsals and metacarpals is that in the metatarsals, the base is comparatively larger than the head. In the metatarsals, base is larger than the head, except the first metatarsal. But in metacarpals, it is the opposite. Head is larger or equal to the base, except the first metacarpal. So, in metatarsals, head is smaller than the base or base is larger than the head, and in metacarpals, head is larger than the base. Okay. Next, The shaft of the metatarsal narrows or tapers from the base to the head because base is larger than the head. But in case of metacarpals, the shaft thickens from the base to the head. It is the opposite. So these are the main features between the metacarpals and metatarsals. Thank you everyone for your kind attention.